Donny was a cheerful little boy who loved Star Wars games, playing with Lego bricks and dreaming of grand adventures, in which he was the hero. But, Donny used to get sick frequently and his mother told him that he had been ill many times since he was a baby. However, since they lived in a fairly remote rural area, there were no large hospitals nearby, and Donny was managed with antibiotics for his symptoms each time he fell sick. However, when Donny was 3 years old, his father got a new job and they moved to a large city. City life was fascinating for Donny and he liked going to the park to play with other children. Soon one day, after a long but fun-filled day at a nearby water park, Donny started feeling feverish, and his mother took his temperature and found he was running a high fever. He developed other symptoms of cough and difficulty breathing, and so she took him to the local hospital along with his favorite companion, Pugs the panda. The pediatrician met with Donny and his mother, took a careful history and conducted a thorough physical exam. He then explained to Donny's mother that he needed to run some blood tests on Donny to confirm his suspicions of a defect in his immune system. So, off went Donny with Pugs to get his blood drawn in the laboratory for testing of his antibody, immunoglobulin, levels along with other tests. On getting the results, the pediatrician decided to refer Donny to a specialist in the same hospital, Dr. Butterworth. The new doctor, Dr. Butterworth, introduced herself as a pediatric immunologist and won Donny over quickly with her playful and jolly manner. She reviewed Donny's clinical history and lab results and told his mother that he had a rare genetic immunodeficiency disorder, which prevented Donny's B cells from developing normally in the bone marrow and making infection-fighting antibodies. She said Donny's condition, called XLA or X-linked agammaglobulinemia, could be treated by replacing the deficient immunoglobulins with regular treatments. Donny came to the hospital every month to receive his treatment of intravenous immunoglobulin, and when he was sick, sometimes a home health nurse would visit him at home to administer the necessary treatment. As time passed, with careful and regular care by his local physician, Donny continued to grow and thrive and attended college, following which, he got his first job working in a bank. He soon met a young woman whom he later married, and not long after, he had his first child, a son, whom he named Gordon. By now, with advances in medical knowledge and treatment, Donny was administering his own immunoglobulin treatment at home, called subcutaneous immunoglobulin therapy, which dramatically improved his quality of life. He often took his young son, Gordon, fishing on the weekends, and marveled at how fortunate he had been to get the right diagnosis and treatment that enabled him to live a meaningful and good life.